Do you have an advance directive? Do you really even understand what an advance directive is? It's an important topic, but one that we really don't talk about as often as we should, but we're going to change that today. This is Reverend Joey Holland, who is a chaplaincy manager here at Phoebe. Explain to us what an advance directive is.
Ben, that's a great question. Many people don't know what they are. An advance directive is a legal document that allows you to select your treatment preferences in medical care in the event that you get into a place where you can't make those decisions, so that that burden doesn't fall on your family.
In your role as a chaplain, do you often end up counseling families of patients who don't have an advance directive or counseling patients about advance directives?
I do. I find, even though advance directive is a legal document, it's also a document that helps with that emotional and spiritual distress that families find themselves in. I find that if a patient have already had the conversation with their family, it really helps to reduce that stress when we get to a place of having to make decisions.
Now, I'm relatively young and healthy, so I might feel like, well, I don't want to think about that. I don't want to have to deal with that. But now really would be the best time to think about an advance directive,
Absolutely,
right?
Absolutely. I tell everyone that everyone needs to consider having an advance directive. I have situations, for example, just this past month, I had a situation where a patient came in relatively young, had a stroke. His wife felt like that they had had conversations and she knew exactly that he would want all life-saving measures done. On the other hand, the son felt like he had had a conversation and he thought that he wouldn't want anything done and to be on any kind of breathing machine. And so there was confusion, and the medical team was at a standstill waiting for the family to make a decision. And so it really helps to have that decision in writing so that there's no confusion for the family or for the healthcare team.
Now, in Georgia, an advance directive kind of includes or takes the place of a living will and durable power of attorney. Explain what those are.
That's correct. So it's a really great thing that the advance directive here in Georgia has done. You take the living will, which is a legal document that specifies your treatment preferences that you want, so that if you ever get to a place where you can't decide, you've got that in the living will. Well, the durable power of attorney is a legal document that specifies who gets to make those decisions. The advance directive takes both of those and brings them together so that it's really easy and it's simple to fill out.
And it is a legal document, yes. But do you need to pay an attorney to get one done?
You don't have to do that. They're very easy, and that's the beautiful thing about an advance directive. There are 4 parts to the advance directive. The first part, you choose the healthcare agent or a proxy, and you can list multiple ones. That's the first part. The second part, you decide your treatment preferences. Third part, in the case of long-term situations, you decide guardianship. And then the fourth part, which is really easy, you sign it and you get 2 witnesses to sign it. There's no need for an attorney. Now you can, if you wanted to, have an attorney help you, but there's no need to do that.
What are some of the kind of specific kinds of care or specific decisions that are outlined in an advance directive?
So you can make them as complicated or as simple as you want when you fill out the advance directive. There are life-saving measures such as a breathing machine or CPR, things like that. You can specify whether or not you want to be given nutrition by feeding tube or fluids by feeding tube. Or here's one that a lot of people don't talk about and haven't thought about: organ donation, tissue donation. There's a lot of people out there who are waiting for someone to be available to donate an organ, but they've never had this conversation with their family. You can indicate that on your advance directive.
So to wrap it up, really, what is your best advice about advance directives for folks?
Very simply, I would say, have that discussion with your family. First, gather your family, whoever the members of your family are that need to be there, gather them together, have discussions on what you would want or what you would not want done in the case you were in a situation where you couldn't talk. And then after you talk with them, write it down. Make it a legal document so that it takes the confusion out. It's a terrible thing when I see families come in and there's confusion And in a time where they need to be leaning on one another during the most difficult time of their life, they're in turmoil. And the advanced directive would really help to take care of that.
Reverend Holland, thanks for joining us today to talk about this important subject. And we have links to resources that can help you make advanced care plans with this video on our website, so check those out.